Excellent. Um, so why don't I go ahead and start? Um, so I'll say good morning. It's Monday, December 15th. This is uh, the meeting this is a meeting of the PFAS Advisory Committee. I'm Representative Dan Ankeles. I'm one of the co-chairs along with Senator Stacy Brenner. And the first thing we do is just go around the Zoom and do introductions. Um, Again, I'm Rep. Dan Ankeles. I represent Brunswick. I serve on the Environment and Natural Resources Committee. And I'll turn it over to Director Valentine.
Good morning. I am Beth Valentine. I'm Director of the PFAS Fund at Maine DACF. Do you want me to call on people?
Yeah, if you don't mind.
Sure. Commissioner Beal.
Yes, good morning, everyone. I am Amanda Beal, Commissioner of the Department of Agriculture, Conservation, and Forestry.
Commissioner Loisum.
Good morning. I'm Melanie Loisum, Commissioner of the Maine Department of Environmental Protection.
Deputy Director Nancy Beardsley.
Hi, I'm Nancy Beardsley. I work for Maine CDC.
Keisha Holmes.
Hi, I'm Keisha Holmes from Misty Brook Farm, and I'm here representing Ag.
Jenny Tilton Flood.
Good morning. My name is Jenny Tilton Flood. I'm a dairy farmer in Clinton, Maine, and I represent agriculture as well.
Lucia Brown.
Good morning. My name is Lucia Brown. I am the Deputy State Executive Director for the Farm Service Agency in Maine.
Senator Rick Bennett.
I'm Rick Bennett. I have the honor of serving the people of 14 towns in Western Maine in the state Senate across parts of Androscoggin, Oxford, and Cumberland counties.
Adrienne Lee.
Hi, I am Adrienne Lee, Knox, Maine. I have a organic vegetable and flower farm and have served on this committee for the past few years.
Becca Bolas.
Good morning, Becca Bolas, Executive Director at Maine Public Health Association, and I represent public health.
And have I missed any committee members? Hearing no response, I'll call on PFAS Fund staff to introduce themselves. Melissa Hamlin.
Hi, I'm Melissa Hamlin. I work in the PFAS Fund as a management specialist.
And Sarah Wilcox.
Hi, everyone. I'm Sarah Wilcox. I'm the research administrator for the fund.
Thank you.
Excellent. So we have a handful of items to get through in the 1 hour window that we put forward for this. The first item is kind of a housekeeping thing, committee membership, and I was going to turn that one back over to Director Valentine.
Sure. I want to acknowledge reappointments of 3 of our committee members representing the farming community. So Adrienne Lee, Keisha Holmes, and Steve Crane have all agreed to serve a second 3-year term, so through October of 2028. Thank you. Also, our chairs will continue to be Representative Ankeles and Senator Stacy Brenner. No one else stepped forward to take a position as co-chair. So for the time being, we will stay with the tried and true. Thank you both also for that. A quick reminder about FOA requirement, a FOA training requirement. Those of you that are legislators or commissioners, you have this covered already. Otherwise, all members of boards and commissions are expected to complete training on Maine's Freedom of Access Act by January 22nd of 2026. Please refer back to my email of November 24th. There's a link to the training. It's pretty straightforward. Review that website, complete the form, and send it back to me. Thank you. I guess with that, would you like me to give a quick update on our activities since the advisory committee last met in October?
Yes, please.
Okay. I will go ahead and share my screen. Is everyone able to see the presentation? Okay, so the agenda we've already covered. Financial and technical assistance, I'll go through each of the 4 categories of the program, starting with financial and technical assistance, and really no significant changes since we met in October. We have provided about $2.3 million in direct financial assistance since the program launched in March 2024, primarily in the form of income replacement payments, administrative cost grants, and professional services like business planning. On the land front, you're all aware we purchased a property in Palermo back in February. We are finalizing the VRAP environmental covenant. We've been notified by DEP that no further action is required in terms of investigation or remedial action as long as DICF follows certain restrictions and conditions. For instance, groundwater extraction is prohibited. The site cannot be used for residents, for schools, for childcare. Also, any agricultural activities must be conducted with consideration for current PFAS soil and groundwater risk guidance. It must be consistent with an agricultural and monitoring plan approved by DACF's PFAS response program. So our next step is to finalize and record an environmental covenant describing these same restrictions that will be recorded in the Registry of Deeds so that any future landowner is aware of these restrictions on the use of the property. You'll recall that the PFAS fund's goal is to return any PFAS impacted property to agricultural production whenever possible. So toward that end, and with consideration for the environmental covenant, we expect to soon advertise this property as being available for corn production. In the past, this land was used for hay production. The levels of contamination in the 12 to 13 ppb range for PFAS and PFOA isn't suitable for hay production for dairy animals, but could be used for corn production because of the lower transfer factor into grain. And particularly if this corn is used as just a small portion of the animal's ration, we're comfortable that it does not pose a risk. But under the terms of this lease, the farmer who cultivates this land will be required to work with the PFAS response program so that there's monitoring of the product being harvested from the land, as well as milk or beef produced from the animals that consume it. So that we're getting close to advertising the lease for that and hope to have it in place so that cultivation can begin this spring. Management of the property, we are coordinating with the Maine Forest Service. The local district forester walks the property periodically just to have eyes on the property. Maine Forest Service will be developing a management plan for the forested portion, and Melissa is the lead for overall stewardship and the point of contact for use of the agricultural field. We anticipate paying a fee in lieu of taxes. The amount has been calculated to be what a private landowner would pay if the property were enrolled in an open space tax program. So we're just working out the mechanics of doing that. And we anticipate closing on a second property in about 2 months' time, around February 2026. So research, We have 2 RFAs open for targeted and major research grants. The targeted grants are up to $100,000. The major grants between $100,000 and $500,000 each. Pre-proposals have been submitted. We received about 40 for the 2 different programs. We have provided initial non-technical feedback, essentially telling the applicant whether their proposal is deemed to be competitive. Even if they're on our initial take is they're not competitive, they can still apply. So full proposals will be due February 13th, and then there'll be a full peer review process of the technical merits of the proposals. DACF continues to act as a matchmaker between researchers and farmers who are willing to host research. We maintain a list of farmers who are willing to either provide access or provide samples, whether it's soil or a farm product, and researchers who are looking for a farmer to work with contact the PFAS fund. We share those inquiries with the farmers. We do not outwardly provide names of PFAS impacted farmers to protect their privacy. Coming soon, within the next 2 weeks, we will be posting on our website a process for researchers to access land purchased by the PFAS fund. So the site in Palermo, and then the second site that we hope to close on in the coming months. Essentially, researchers will contact first Melissa, the land steward, to see if their proposal is consistent with the stewardship plan for the particular property. If so, the proposal is passed on to the research advisory panel, who considered the proposal in light of the fund's research priorities. Is this a good fit? Will it help us answer questions that will help advance the work of the department's response to PFAS in agriculture? If that's true, then it goes back to the full land advisory panel, again, for consistency with the stewardship plan for the property, and also to make sure that there are no conflicts with other uses of the property, whether it be other research projects or agriculture. So we'll be posting that on our website within the coming weeks. And then blood serum testing. This has been the most active area since we last met. You'll recall that individuals whose water tests above 20 ppt for the sum of 6 PFAS, or whose soil tests above 170 ppb PFAS, folks who measure above those thresholds are presumptively eligible for PFAS blood serum testing paid for by the PFAS fund. So at the end of September, we sent direct mailings to 614 presumptively eligible households, asking them to respond to a survey telling us who has lived and worked on that property within the past 10 years. We've received 83 responses. Those 83 responses identified a total of 336 individuals who have either, again, lived or worked on the property within the past 10 years. And we have since sent authorization forms to those 336 individuals. They then take this authorization form to their primary care provider, who orders the test. The test results are sent directly to the physician, and ultimately the PFAS fund will get a bill for the portion that's not covered by insurance. Rule 407, which is the department's rule governing PFAS blood serum testing, allows for waivers. So for individuals whose soil or water does not meet these particular thresholds, but there is a credible link, there's a credible exposure route from the land application of biosolids to that individual. So an example may be a hunter who has harvested deer for many years off of a PFAS impacted property that the hunter doesn't own, but we know has high levels of PFAS. That is an instance where we would consider in consultation with Maine Center for Disease Control and Prevention and Maine DEP, whether a waiver would be warranted. So we're right now, the waiver has been a little bit word of mouth, but again, we'll be posting the procedure to follow on our website in the coming weeks. I want to share that anecdotally, there is broader interest in PFAS blood serum testing than what the PFAS Fund can support. We have been tracking inquiries that we've been receiving since we launched the blood serum testing program. To date, I think there have been, 42 inquiries. And of these, 14, so a little less than a third, have been from people who would like a test but don't meet the fund's soil or water exposure eligibility criteria. Their exposure may have been through municipal water, or they just live within a highly contaminated community, or through military service. So I'm just putting it out there that while our focus is on individuals impacted through the land application of biosolids, there is broader interest in blood serum testing. Then my final update related to blood serum testing is that the Maine Mobile Health will have a clinic at the Agricultural Trade Show January 13th through 15th of 2026, so coming up right after the holidays. Maine Mobile Health is a network of doctors, nurses, counselors, community health workers, and educators that work together to provide primary health care to agriculture and aquaculture workers, seafood processors, and their families, regardless of insurance status or ability to pay. People can qualify to be a patient in the program if they or a family member works in agriculture or seafood processing, or their main work has been in one of these industries in the last 24 months. So that's Maine Mobile Health in a nutshell. During the trade show, they will have a pop-up clinic where they will be offering free health screenings to any attendees. So things like blood pressure screening, body mass index, depression, anxiety. Anyone who's at the show, whether they're a presenter, a vendor, a participant, an attendee, can go and take advantage of these free screenings. Maine Mobile Health will also be collecting blood samples for the PFAS Fund's blood serum testing program. So people who have their authorization letter can bring that with them and have their blood drawn at the trade show. And my last update relates to revisions to the PFAS Fund's rules. You'll recall that we've proposed changes to chapters 400 through 408, primarily to improve clarity and consistency. The comment period closed on November 7th. We received no comments on chapters 400 to 406. So I've been in touch with the AG's office as recently as this morning, and we're working towards finalizing those in the very near future. The comments we received on chapters 407, which is blood testing, 408, mental health services, generally called for expanding eligibility. So at the staff level, we have made some further revisions, and we will be opening a new 30-day comment period, probably early in the new year. So that will be publicly noticed on the department's website, as well as written, published notices in the Kennebec Journal, Portland Press Herald, and other newspapers throughout the state. So that's it for my my updates, and I'm happy to take any questions.
I did want to just tee it off by asking if there are specifics available about what kind of revisions were done for those two items that did get comments.
Yeah, so the revisions will be published, the proposed revisions. So one example is extending eligibility to children born to farm workers, mothers who worked on a farm who carried the child while working on the farm or within, some period after, or who nursed that child. And so that's a pathway that isn't explicitly in the current version of the rule that is in our working draft. But again, we're still working through what those revisions would be. We are maintaining throughout these proposed rules the connection back to the land application of biosolids.
Okay, so we have one hand raised, so go ahead.
Hi, and this question is awkward, and I don't know how to ask it correctly, but with regards to the land purchases that you were discussing, I'm so glad to see that being accomplished. Is that process of payment and procurement a competitive process? Is it put out to bid? And I ask this just because I am appreciating in recent days the amount of carefulness and caution and care that has been exercised by the departments over the past several years with regards to incidents and discovery of PFAS contamination and efforts to deal with it and mitigate it before this system was in place. So I'm just curious, and I haven't done my FOA stuff yet, so I don't know. But do you know what I'm asking? How is it going? Is there going to be a way to balance the public's access to information about their fund spending and how government works, and a protection for those who find themselves as victims of PFAS?
So you're asking about the land purchases and not about the lease once it's been acquired?
Yeah, so the land purchases, is there going to be a justification form accompanying that, or was it put out to bid? Is it possible that some imaginary media-like entity is going to get the information in the report and disclose all the information in a way that can be harmful with and have unintended consequences?
So landowners approach the PFAS fund. We have an inquiry form. If someone's interested in selling their property, they contact the fund. And we have a process that begins with a discussion between Melissa and likely somebody from the PFAS response program to ensure that the landowner understands the extent of contamination and the restrictions on their property. So they're sort of going in with their eyes wide open. If they want to proceed, we'll go ahead and order an appraisal. Again, at that point, the landowner has the opportunity to decide whether to go forward or not. Assuming the answer is yes, the fund pays for all of the due diligence costs, a survey of the property, et cetera. We get to closing. Through all those initial stages, we do not disclose the name of the landowner because we're sensitive to the impact of being called out as being a PFAS impacted property. Once the property is closed on, the deed has to be filed in the Registry of Deeds. So intrepid reporters have gone to the Waldo County Registry of Deeds and identified the seller of this first property. It's a public record. I do not see any. To your point, I think the public has a right to know when property is purchased by the state. So that is a matter of public record. To date, the fund has not identified the seller of this initial property, and generally speaking, our policy is to maintain confidentiality of farmers working either with the PFAS fund or the PFAS response program. And we report results in aggregate.
Okay. My only other question, I don't see any other hands up at the moment, but just since we are on the PFAS fund update section of the agenda, do you have in front of you the balance, the current balance of how much is remaining in the fund?
So we have encumbered 18.6 million of the original 60 million, leaving 41.6 million available.
Okay. And does that, when you say encumbered, does that include some of the items that were on the previous slides?
Yes.
Okay.
Yeah, that includes the
It's
so 2.8 million expended on direct financial assistance, plus an additional 18.6 that's been encumbered but not yet spent. So where we've put, we've set aside a chunk of money for example, for farm viability payments, infrastructure grants, et cetera. So that money is sort of in its own line item and it's protected, but we haven't made payments against it yet.
Gotcha. And the reason I asked that is because it's a very nice segue into the next two items on the agenda. So are there other questions on the director's report before we go to the next piece of business? Okay, I'm not. Oh, Adrian Lee. Go ahead.
Yeah, just to follow up, Beth, with that, because I'm just trying to think through like how much money is left in the fund. Does that include, when you're saying encumbered, I just don't know all the lingo there, but does that include like commitments, like the grant is going to pay for X amount in research funds, as in like I put aside, like it kind of like anything that has been promised to date? Is that what that means?
Yeah, that's a good way to think about it.
Okay.
Well, although research isn't a great example. The research funding to date has been supported by USDA. So that $5 million total from the USDA grant is separate from the
Yeah.
4.16 million that hasn't been encumbered yet.
Okay.
But yeah, where we have an agreement with CDC to do some work and some research for us, that money is set aside for CDC.
Okay. Thanks
as
for
one
clarifying.
example.
Have there been any kind of indications of potential disruption from the USDA portions of the funding that is administered, or is it still operating nominally at this point?
So far, I'm looking for some wood to knock on. The bills have been getting paid. That's
Okay.
all I know. My contact
news.
at USDA, he's not getting a lot of guidance either.
Commissioner Beal.
Yes, and I just wanted to verify, I know Beth, we talked about it, but that $5 million grant is essentially completely spent or encumbered at this point in time. Is that correct?
Yes.
Yes, okay.
So then the next item on our agenda is discussion of LD 582. This is Senator Brenner's legislation. I believe it's on the appropriations table. This is the bill that mandates insurance coverage for blood testing around PFAS contamination. And this, it's important to note, it's not related to any specific use like farming. This is for any kind of any source of contamination or any chain. And so we had sort of taken this up at our last meeting, and we were going to take it up again in a little bit more specificity today, just to talk about what if any role we think this or what if any advice this advisory committee might give to lawmakers around this particular bill. And before I turn it back over to Director Valentine, just by way of information, the official fiscal note on this is in fiscal year 27, which starts in June 1st of next year. It's a $90,000 general fund fiscal note. But then when you look at the out years, that number goes up to roughly $206,000 starting in FY 28, 29, and assuming you would assume moving forward. So it is an ongoing fiscal note, even though it officially looks like it's only $90,000. And so, setting that context, I want to turn it back over to Director Valentine to sort of give us the latest.
Sure. I'll share my screen again and a few more slides. Oops. So I just pulled these excerpts from the bill. As Representative Ankley's just described, the bill requires health insurers to cover PFAS blood serum testing, and the state benefit mandate defrayal, that first year is $90,000. And so I wanted to think about this in the context of the purpose of the PFAS fund. So this is from the statute establishing the fund. Allocations from the fund may be used as determined by the department upon recommendation of the advisory committee, all of you. And these purposes include monitoring the health of a person and members of that person's household whose agricultural land is found to be contaminated by PFAS. This is the authority that underlies our current PFAS blood serum testing program and is tied back to contaminated property. Another potential use of the PFAS fund is providing medical care to a person found to have blood levels of PFAS greater than the general population or health effects associated with exposure to PFAS. This could be interpreted because it falls sequentially after the first, which links the monitoring to agricultural land, that this providing medical care applies to that same population, people exposed through land application of biosolids. It could also be interpreted more broadly to providing medical care to a person found to have blood levels greater than the general population. So that is kind of, I guess I'm putting the question to the committee, how comfortable would you be seeking an expansion of the purposes of the PFAS fund that would allow for the fund to support blood serum testing for the general population, not just those impacted through state licensing of biosolids? And then, okay, I'll stop there. And Jenny, go ahead.
I'm just curious, and I should know this, and I'm not sure, but does the proposed bill, not directly related to this, but in a way, yes. Does the proposed bill include also, like, would the Department of Veteran Affairs and veteran care fall under a health carrier? Would they be reimbursed for testing people in this state? Or, because I'm just curious if they would also, or if they would be providing the care without the reimbursement. Does that make
So
sense?
are you asking if somebody had their blood tested at Togus?
Yep.
Would that be covered through the Veterans Administration?
Right.
Or
And then
would they seek reimbursement from the
right,
PFAS
with the
fund?
Veterans Administration testing a member of our Defense Department for something they've been exposed to there, then seek reimbursement from us or from either this bill and the state fund or an expanded version of the PFAS fund for that. That I just am curious if that's separate from a health carrier. I don't know the language and the definitions. I'm just seeking clarification. It doesn't
Right.
impact how I feel about this. I'm
Right,
just
right.
curious.
No, I understand. And I guess I likewise don't fully understand what a carrier would mean. And maybe Nancy Beardsley, you could hop in here, but I think a carrier means an insurance company, not like Maine Care, not the VA. Presently, the way the PFAS funds program is set up is that we pay for costs not otherwise covered by insurance. So we don't say anything about coverage for veterans. And again, the as currently designed, the program doesn't cover veterans, so we had no need to include them. Let me show just this final slide. These are the eligibility criteria in the PFAS funds rule presently. And this will likely stay consistent when we share the next version. And it's the details that fall under this broad statement that we'll be tweaking. So someone is eligible for blood serum testing if they've lived on, worked on PFAS contaminated property for any portion of the 10-year period preceding the discovery of PFAS, when the PFAS contamination is reasonably determined to be the result of the land application of residuals. So again, that connection back to contaminated property. I'll stop sharing so we can see one another.
Right. I see Adrian Lee has her hand up, so I'll call on you.
Yeah, I guess a couple clarifying questions. Like Jenny, I guess I'm just trying to get a handle on maybe to some degree size of the population we're talking about. From reading the proposed bill and looking, I feel like I'm still struggling with like understanding enough about how those people that are seeking to get tested, like how it's determined that it's medically necessary, like what the parameters are there if it's not attached to land spreading. And then also the level of expectation of like, it doesn't really spell out in here, like, is it saying that if they're proposing that hopefully the PFAS fund would dollar for dollar reimburse insurance companies, like there's no burden on the insurance company as looking at as a preventative care or anything? Just thanks for clarifying these things. Like I have assumptions on what I think it means, but I just want to make sure that my assumptions are matching the facts.
And I think it's I did want to read an item from the chat real quick from the CDC toxicologist Andy Smith. We do know from our pH oversight of blood testing that there are some docs at the VA ordering PFAS blood testing and also some workplace health docs performing ongoing workplace testing that is happening. So I just wanted to make sure that was read out loud. Director Valentine, did you want to speak to what Adrian raised or the comment from Director Smith?
Yes, I want to make sure I understand Adrian's comment. And it's a fair question. What is the size of the population that would be eligible? And I think that's an unknown. The determination, if this bill goes forward, well, it's tied to the NASM guidance. Sorry, I'm scrolling back. Yeah, so Enrolli meets the clinical guidelines for blood testing for PFAS established by National Academies of Science, Engineering, and Medicine. And that guidance is generally, based on a medical history with some known exposure, whether occupational or environmental. But it's a judgment call. So, I think it's hard to estimate how many people would, one, seek testing, and two, whose doctors would deem it medically necessary.
So to set a little context, this particular bill, I mean, it asks the question, should the state mandate coverage? And the question we're wrestling with is a slightly different question, which is, should this fund be the source of paying for that bill's passage, right? And that, as the director hinted, probably requires amending the language around what makes this fund this fund. And I did want to add a thought here. I'm going to venture into the world of opinion for a minute, which is that the bill asks for an ongoing expense from a fund that does not have sustainable replenishment built into it. So this and we also don't know the size of the testing population if we expand it. And so we're sort of maybe tempting fate with like having this fund that was meant for very specific agricultural purposes run out of money. And I represent a district where we would love to use some of this money, certainly to test my constituents, because we live near the airbase, and that would be wonderful. But in terms of responsible stewardship, this fund does not have a sustainable funding source. It has what it has, and we have to factor that in when we talk about mandating coverage. So I wanted to just add that out there. And then I see Sarah Wilcox has her hand up.
Sarah, you're
Apologies.
muted.
Yeah, I am. I apologies. I just have a question for clarification. The fiscal note, the cost of this bill to the state would have to do, I think, with insurance or healthcare coverage that's provided by the state to employees. Would it be that the fund would be paying? If there's someone who works for a private employer who has health insurance, that insurance would then be mandated to cover the cost. In that case, the insurer would pay the cost, I would assume. And then but there would be a cost to the state of Maine if the bill is passed of additional costs of insuring people employed by the state. Is that the right interpretation or the wrong interpretation?
I suspect it's correct. And the reason I suspect that is because in the out years, you start to see not just a general fund cost, but a highway fund cost. And what that tells me is that it's about personnel, because we have a lot of split funded positions between the general fund and the highway fund when it comes to state police and that sort of general area. People who work around infrastructure sometimes are split funded in our state budget, for better or for worse. And so I suspect that that's exactly why the fiscal note looks the way it does. But I would leave it to. I'm happy to be corrected if I have it wrong.
Yeah, I simply don't know, and how like main care would fit in there.
Right.
So,
but in general, might be a savings to the fund if insurers were required to cover the cost of the test, because someone who currently doesn't have access and would need to come to the fund, if they have or if it was due to contaminated land, that would then be covered by their insurer, which then would mean the fund wouldn't have to pay that cost in theory. But that doesn't mean that the fund should be on the hook for helping the state support coverage for everyone employed by the state. It doesn't change the basic question, which is can the fund be the source of the funding needed?
And that
So
is
this-
the critical question. And I will point out that an earlier version of this bill prohibited cost sharing. So the insurers would pay whatever they would pay for the bill for the testing, and that would be the end of it. This current amended version allows insurers to seek cost sharing. So they will pay the lab X amount for the analysis, but if there's a balance due, the labs can seek that difference from the individual if they haven't met their deductible for the year.
So, two quick things. One is gonna sort of put it out there and ask what's the pleasure of the advisory committee, but just also note that the next item on the agenda is talking about the interest that is earned on this fund as it sits in the bank. I know that was sent out to members, how much interest the fund has itself earned year over year, and it's actually quite substantial to the point where it would be missed in the general fund, certainly, if we were to sort of repatriate the interest to back into this fund. So the two items are kind of related. So I just wanted to point out that one discussion item might influence another depending on where people are at. But this is a good time, I think, if we want to resolve this item in the agenda. Are there are there any are there any thoughts, opinions as sort of yes or no, or maybe? And I don't know, Director Valentine, should I be calling for some kind of motion or vote? Again, I'm a new chair for,
Right.
so
As an
this is me with the steep learning curve.
Yeah, we generally haven't used formal motions, more of a poll, as this is a non-binding advisory committee.
Yeah.
But yeah, I think calling on the members to give their individual opinions is a good idea.
Shall we go down the line then? Do you think that would be appropriate, of just one member at a time, sort of giving their sense of things?
Sure.
Okay. Would you be willing to call, because I'm still familiarizing myself with who's a member and who's staff and who who's member of the
course, yeah.
public. So this is my bad. I'm sorry.
No. So I'll just call folks in the order that I see you, starting with Adrian.
Sure. I think first off, like you were suggesting, like it's hard to actually even think about a recommendation about if the fund could pay this, with the fact that at current state it's a finite amount. It's almost like, how do you even make that judgment call if it hasn't already been determined that the fund could like hold on to the interest accrued? So I almost feel like this in some ways should be like I know we have no non-binding votes, but if I was going to be voting for something, I almost feel like it would be like, I'd like to know the interest component of this before making any sort of judgment call on what the fund could afford long term. I also anticipate this fund. I mean, so if we've used 18 million of this fund in the course of 3 years, there's going to be no clear additional source of revenue at this point for this fund. especially representing the farming community, I feel pretty concerned that by suggesting making a changes to kind of broaden the scope of who this fund would pay testing for feels very risky from the farming perspective of just supporting the farmers that are impacted over the long haul, while we're still like, I think there's still a lot of farms that are probably just like, maybe whether they've been identified or not, they might not have like accessed supports yet for PFAS and complete, so I'm definitely very aware of that.
Thank you. Jenny?
I think I'll end up echoing a lot of what Adrian said. There's a lot of uncertainty with this, but I do have to say that one of my biggest concerns, and I think one that she also articulated, and I'm sorry to repeat it, but I think it's necessary for it to be repeated from multiple people, is that the intentionality of the bill and the fund was specifically related to food production and agriculture in the state. And it's not a matter of gatekeeping or preventing people from finding care and getting the care that everyone should have access to, availability and affordability. But we were entrusted with this fund for specific parameters, and I do worry about expanding them, especially when it comes to fiscal responsibility of the fund, the money that we were entrusted with, how we are to make sure that we allocate it and use it where needed. I'm also a little concerned with an expansion of care being put upon or burdened upon this fund when there are other folks who probably should be taking care of their direct line to people being affected by PFAS. I am concerned about that. I'm also kind of don't understand why we would have to reimburse people for providing adequate care for people. But that's just another question that has nothing to do with what you asked, but I'm going to say it anyways. So.
Thank you, Jenny. Becca?
Yeah, I agree. I think that, I obviously wrestle with this from a public health perspective, but when I think about the intention of the fund, it was to support farmers primarily, and then people who lived adjacent to farms. And and their well water is contaminated from PFAS. And so I appreciate that. I think that we could get spread really thin and not be able to provide the support that people need if we do expand it. And I also think that there are other avenues, like the lawsuits and Senator Brenner's bill around health insurance coverage. Like there are other avenues to explore. But I mean, like I said, I'm also wrestling with it because I know that certainly other people are impacted by their health is impacted by PFAS. I understand what you were saying too, Representative Angeles, about the general fund missing the revenue. I feel like we wrestle with that all the time in different sources of funding. I will say, to me, this fund and this committee and the work that we've done is government responding to a public health need and a public health crisis. And so recognizing that, this kind of was a one-time infusion, if we do consider supporting allocating that revenue into the fund, that interest into the fund, I think in my opinion, it shows a commitment to this public health crisis, that it wasn't just one time. So I get the tension point there. I just also think right now it's important to show that government is responding to a public health issue, and that could be one way to do it. So anyway, those are my thoughts.
Thank you. Commissioner Beal, do you want to comment?
Well, I would say, I mean, I think first and foremost, I'm interested in making sure that we carry out the initial charge that we were given when this fund was established. As to the fiscal questions before us, I will say I haven't had a conversation with the governor about where she is on these bills, so I can't really speak to that. But definitely appreciate folks here sharing their opinions and you know, that any change proposed will have a robust you know, opportunity to be talked about in the legislature, which is also, I think, a really productive place for this conversation to take place. But yeah, at the end of the day, I just want to make sure that we can do what we've been asked to do, and we do need resources to do that.
Thank you. Senator Brenner has joined us, and I know she's just back from a long trip. Senator, to give you a quick update, we've reviewed the essence of your bill. Representative Enkley's shared the fiscal note beyond the 90,000 that shows up for fiscal year 27, looking at ongoing need for over $200,000. And now I'm polling the advisory committee to sort of get their reaction on whether the dollars in the PFAS fund should be used for this purpose that is beyond the initial scope of the PFAS fund.
So was Representative Enkley's able to share with you the purpose of the fiscal note, what it covers? So that I don't repeat that.
So our understanding is that it is for state employees.
That's correct.
Yeah.
And we think that there's the potential that that amount is somewhat overestimated because when this fiscal note came together, the cost for blood serum testing was more expensive than it is now. So we do think that it's slightly overestimated for what the true cost will be. And then the additional expense beyond employee healthcare is something called defrail, which is related to the Affordable Care Act. And it's the state's portion that they need to set aside in order to cover expenses for things that we add to coverage that are not federally mandated within the ACA. And so if the insurance companies request it, there's a time where it may mean that we need to that in order to defray the cost that this portion of money would need to be put forward. The thought is that because each individual occurrence will be so small for an insurance company versus something like a heart valve replacement or actually, let me give you a better example of something that's not included in the federal ACA, fertility support services, quite expensive, big ticket item. An insurance company is pretty likely to look for the defrail from that. But from a blood test for an individual, the thought is it's unlikely that they would seek defrail because of the paperwork and bureaucracy involved. So we think that the fiscal note's perhaps slightly inflated, but the sort of argument here from a policy perspective is to say that it's important to push insurance companies to cover this for everyone, farmers, folks adjacent to farm properties that have wells that are contaminated, as well as individuals like perhaps some of Representative Enkley's constituents that live adjacent to the foam spill. And so being able to push insurance companies to get involved in covering some of the costs of the health impacts is important from a policy perspective. So that's the argument, and asking for the fiscal note to be covered through the PFAS fund was one of the potential directions that we thought we could maybe go in.
Yeah, I don't think there's a debate that insurers should cover this testing. The question is really, should the PFAS fund cover the fiscal note? So we are at time. If we could quickly go through the other advisory committee members to just get a pulse on what your thinking is, and then I'll leave it to the chairs to consider next steps.
Sounds good.
I'll weigh in. This is Rick Bennett. I think I support the proposal. I think we have to be creative about financing these days, and I do think that it's adjacent to the purposes of this fund, and I do believe that the interest payments or the interest received on this money that was appropriated be should remain with the purposes of this fund. So this is really just a time value of money issue, and we haven't spent it that much. Prices on everything have gone up except for maybe blood serum tests, and I think that we should try to husband that money for PFAS remediation.
Yeah.
Thank you. Keisha, do you have any comments?
I guess this one seems a little bit hard to me because if we have the funds available and it could be used to help make the blood testing available to people who need it, I would want to do that. But I also want to have the funds available when we need them for the people that the fund was intended for. I guess my question would be, if we show that we need these funds and we're using them, can we make this a renewable source of funding so that we can continue to do all of the things we need to do to support PFAS impacted people, not just farmers? Because I guess the way I look at it is if you're not using the money, if it's not working for you, then it needs to be repurposed to be working for the community.
Yeah. I don't want to cut off anyone, but since we are at time, I wondered if I'd float, what if this committee were to sort of offer a sort of qualified piece of advice where it said, we would be willing to offer this, or not offer, but we would be willing to support the use of the fund, provided that the fund had a sustainable source of revenue added to it, and that way we can talk about repatriating at least some of the interest, at least enough to continue to keep the fund viable for many years, and also to potentially fill up this defrayal fund that's needed, and kind of kill two birds with one stone. But I did also, full disclosure, I had a pre-meeting a few days ago with Director Valentine, and there was a discussion about the idea of maybe you don't ask for the entire amount of interest since it's such a large amount, but we figure out exactly what level of interest we would need in order to make a more credible ask of the Appropriations Committee or the administration. And so I wanted to just get that idea out there before we feel like we're way too far over time at this point, because we did have one other item about public meeting input before we can adjourn for the day. So I wanted to put that back out there and turn it back over to Director Valentine.
Gosh, I'm struggling with where to begin. So yeah, I think we need more discussion. We haven't heard from CDC, for instance. And I didn't share broadly the interest earned to date on the PFAS fund, but I can let you know that in fiscal year 25, it was $2.8 million. From the inception of the program, the fund has earned 7.1 million in interest. So big dollars. Something to explore. Also want to recognize that that money presently goes into the general fund and is used for other purposes, and it would likely be a heavy lift to redirect certainly all of that money to DACF, but even redirecting a portion is likely going to be a challenge. Deputy Director Beardsley.
Hey, thank you, Director Valentine. And I really appreciate all the conversation. I don't really feel like I can make a decision on the fiscal part of this without talking to my director and our commissioner. But I do have a basic question, which you may have already resolved. I missed the October meeting. And have we confirmed that we have the statutory authority to go in this direction?
That was part of the excerpt from the statute that I shared previously, that so the purposes include providing medical care, which could be interpreted broadly or narrowly.
Right.
So yeah, we would need, I think, a read on that as well.
Okay. Thank you.
Senator Brenner, did you have your hand up? I'm sorry. No, okay. So I'm getting the sense that folks need more time to consider what we've put out here today. And that makes sense. We still do have a little bit of time. At least we could probably meet at least once more before maybe more before the legislature starts to actually make hard decisions around items like this one. So I don't know, what are the rules around exchanging information between meetings and not violating you know.
I think any decision should be made in an open forum like this.
Yeah. But I guess I would propose that we digest this a little bit more. And it sounds like also people need to speak to other members of the administration as well, and other legislators to get a better sense of what we can and should do in terms of advice. But I see Adrian has her hand up, so I'll quickly call on you, Adrian.
Yeah, I don't want to take up too much time, but just was wondering ahead. I think it'd be great to talk again about this, but in the interim, one piece of information that'd be really helpful for me are any comparables on how other funds in the state are using interest. Like, I know it's like the money for the Farms of the Future comes from the like there's different interest used from different pools of funding, and it'd be helpful for me to know, like, how would the concept of using like the fund holding on to some of its interest compare to any other examples within the state. That would be helpful if there is any information there.
Yeah, I can do that.
Okay. So we'll put to use corporate speak, we'll put a pin in this for a minute, because we do need to take care of one last item of business, which is planning for how we do our annual requirement to gather public input in a public forum. So I'll turn that back over to Director Valentine.
Yeah, I want to propose that we structure our next offering around our annual report due to the state legislature. So annually on March 1, the department needs to give a report to the legislature on everything the fund has accomplished over the previous year. For the past 3 years, we've had sessions at the agricultural trade show where we've invited the public and asked for feedback and input, and heard a lot of crickets. I think it's not really a comfortable situation to solicit input. And also, there wasn't anything really specific for people to respond to. So my thinking was that maybe a month after the annual report is issued, that will be a document that people can peruse, come up with questions. So it might be a more fruitful exchange. So I guess I wanted to put that out there as an option. And remind you that we do have a statutory obligation to have at least one meeting annually for the purpose of soliciting public input on implementation of the fund.
What do folks think about this? I'll look for hands. I'm seeing at least one thumbs up emoji. I personally, I think it makes sense. I'd be good with this, particularly in light of, in our last meeting, we kind of talked about what some of the issues are with doing this at the trade show, and which raised issues of discomfort and reluctance to raise issues. And if you remember from the last meeting, we were kind of searching for an alternative, and I think this is a good one that the director has proposed. So that's where I'm at. Thumbs up. I'm not seeing any opposition to it as I look through the chat windows. So I'm going to ask, is the committee okay with this generally? Yes. Okay. I'm seeing head nods and thumbs up, double thumbs up from Senator Bennett. Excellent. So that was our last item. Is there anything else folks want to raise before we break? I know we're 15 minutes over, and I do apologize to the committee members for that. Okay. Well, I hope you all have an absolutely oh, wait a minute. I saw a hand from shoot, hold on. I did see one hand up, and I'm looking for where it went. Nope, it's gone. All right. So I hope you all have a wonderful holiday. And Director Valentine will get back in touch with all of us about our next meeting. And we can go forward from there when we talk about the interest in the legislative proposal about insurance coverage for blood serum testing. So thank you all for your hard work. Thank you all for going over time with me a little bit, and have a wonderful holiday.
Thanks, everybody.
Thank you.